One of the ways I think the Magellan robotic catheterization system can bring benefit to the EVAR procedure is by reducing contrast and reducing time and reducing the number of catheter exchanges that are necessary to accomplish a certain number of tasks. And this is what we're evaluating here at BCVI at this point in time. So for instance, you start an EVAR, you put a pigtail catheter up, you do an angiogram. Do you need that angiogram? Well, with 3D fusion and other techniques, probably you don't. And so we have already moved beyond doing that. So what do we need a pigtail catheter for? What we need to do at the beginning of the procedure is be able to identify where the proximal landing site is going to be and be able to identify it with precision so we don't make a mistake, cover the renals, land too low, land too high. And what we found is that by taking the robotic catheter and just directing it towards the lowest renal artery catheter, that's the leader, so to speak, in robotic terms, we can, with very small hand injections, just trickle contrast. And because the renal arteries are posterior, you don't have to blast and get a big aortic bolus. You just do a very minimal hand injection, 2 or 3 cc's, and it goes right into the renal artery. So now we have a way of identifying the renal artery. So the beginning of the procedure for us actually starts with placement of the robotic catheter and direction. Then we immediately move to the endograph. We go about putting in the body of the endograph, doing the positioning, using the robotic catheter now in the workflow to deploy the proximal part of the endograph, whatever kind it may be. Then once that's deployed and we're in position, then we just straighten out the robotic leader catheter, bring it down to the position in the sac, and we catheterize the contra limb with the same device, the wire. We put the wire back in. And so what have we avoided? We've avoided a pigtail. We've avoided putting in another wire, changing out to a steerable catheter, maybe sometimes multiple, for cannulating the contra limb. And we've done that with a single device with reduced contrast, which means reduction in X-ray, because we don't have to do as many runs, we don't have to do as many frame rates and so on. So we're looking at how we can modify and improve the EVAR procedure that way.